If you're approaching 65 or love someone who is, you've probably heard the word Medicare about 1,000 times. Today, we're going to talk about what it actually covers, what it costs, and where to even begin. Any confusion is completely normal, and believe me, you're not alone. This video is specifically for 2026, but once we know the numbers for 2027, those videos will be released as well. Welcome to Tony Explains. When I found out how difficult it is to navigate the modern healthcare system and how many people are trying to scam the generations that came before me, I decided to use my role as a professional journalist, my degree in healthcare management, and my experience running a YouTube channel to create a solution without a sales pitch. My goal is to help you understand and protect the benefits you've earned. Every situation is different, so these videos are for information and educational purposes only, using publicly available data, simplified and organized in a more manageable way. Medicare is a federal health insurance program primarily for people who are 65 or older. It also covers certain younger people with disabilities and people with end-stage renal disease. It's run by the Centers for Medicare and Medicaid Services. You'll hear that called CMS. Medicare is not free, and it's not the same as Medicaid, which we'll go over in a later video. Those are two different programs. Medicare is also not a single plan. It's broken into parts, and understanding those parts is the foundation of everything else. Let's walk through each one. Part A is your hospital insurance. It covers inpatient hospital stays, care in a skilled nursing facility, hospice care, and some home health care. Most people don't pay a monthly premium for Part A if they or their spouse paid Medicare taxes for at least 10 years while working. In 2026, the Part A deductible, which is what you pay when you're admitted to a hospital, is $1,736 per benefit period. That's not per year, it's per benefit period, which is an important distinction we can dig into in a future video since I want to keep this as direct and straightforward as possible. Very simplified, the benefit period begins the day you're admitted to a hospital or nursing facility and ends once you've been released from inpatient care for 60 consecutive days. Part B is your medical insurance. It covers doctor's visits, outpatient care, preventative services, and medical equipment. Part B does have a monthly premium. In 2026, the standard Part B premium is $202.90 per month. And the annual deductible, which is what you pay before coverage kicks in, is $283. Now, I know there's a lot of numbers here, so at the end of this video, I'll put up a graphic that you can take a screenshot of. If you don't know how to do that, let me know what phone you're using in the comments and I'll walk you through it. As I was saying, the annual deductible for Medicare Part B is $283. However, if your income is above a certain threshold, you may pay more for Part B. This is called IRMAA or IRMAA, depending on how you prefer to say it. I like to stick with IRMAA. That income threshold is based on your income from 2 years ago. So in 2026, they'll look at your income from 2024. If you're a single individual and made $109,000 or less, you pay the standard premium. For married filing jointly, it doubles to $218,000. If your income is above that, it goes up in tiered brackets. If that applies to you, Social Security will notify you. For questions about your specific premium amount, contact Social Security at 1-800-772-1213 or visit ssa.gov. That's S as in Sierra, S as in Sierra, A as in Alpha, .gov. When you hear Original Medicare, that means Part A and Part B together. The traditional government-run program. You can see any doctor or specialist who accepts Medicare, and there's no network to worry about. If you go with Original Medicare, it doesn't cover everything. This is why a lot of people choose to add a Medicare supplement plan, also called Medigap. This is going to be sold by private insurance and should offset the gaps in coverage. Medigap premiums vary by insurance company and the state you live in. Your state health insurance program, which again we'll cover in more detail in a future video, offers free, unbiased counseling to help you compare private insurance options. You can find your state health insurance assistance program at shiphelp.org. That's shiphelp.org. Let's go over a quick distinction between Original Medicare and Medicare Advantage. Medicare Part C is Medicare Advantage. It's where private insurance companies come into play. These plans often have lower out-of-pocket costs on the surface, but they typically use networks, meaning you may need referrals or be limited in which doctors you can see. Medicare Advantage plans are approved by Medicare and must cover everything Part A and Part B cover, but they're sold and managed by private insurers. Many of them bundle in Part D drug coverage and extras like dental or vision. What's available to you and what it costs varies depending on where you live and what insurer you choose. And if you want to compare plans in your area, go to medicare.gov/plan-compare. Part D covers prescription drugs. It's offered through private insurance, either as a standalone plan added to original Medicare, or bundled into Medicare Advantage plan. As of recording this video, there's now a $2,000 out-of-pocket cap on Part E drug costs per year. Specific drug coverage still varies by plan, so always check that your medications are covered before enrolling. And just to clarify, you cannot have both Medicare Advantage and Original Medicare with a Medigap plan. Whether Original Medicare or Medicare Advantage is right for you depends on your health needs, your doctors, your prescriptions, and your financial situation. I just want to quickly thank you for watching this video. It's the first one I've made for this channel. I know people are always trying to sell something nowadays, and I don't want to be one of them. If you find this video helpful, please hit the thumbs up button, which tells people you found it useful. And if you want to stay up to date on topics like these, you can hit that subscribe button so my future videos will show up for you once updates are released. Thank you in advance. It really does help the channel reach more people who could use information like this. And back to the script. Alright, so let's talk about timing. When can you sign up for Medicare? The first time you sign up for Medicare, you have a 7-month window to do so penalty-free. This 7-month window begins 3 months before the month of your 65th birthday. So the month of your birthday, and the 3 months before and after that month. If you need to know what month that will be in, just put the month of your birth in the comments and no other personal information. You can face late enrollment penalties that unfortunately can follow you for life. And it can be incredibly frustrating when something with this type of impact doesn't come with any flashing lights or really big warning signs. So please mark your calendar and plan ahead. And there's a good chance you've probably heard of a different enrollment timeframe between October and December. This is for those who are already enrolled in Medicare and need to make changes to their existing plan for the next year. If you're still working at 65 and have insurance through your employer, you may be able to delay Part B without penalty. If this applies to you, contact Medicare directly. Their phone number is easy to remember, 1-800-MEDICARE or 1-800-633-4227. They'll help you understand how your situation works without having to make any assumptions. I know this information can seem extremely intimidating, and there was a lot of information in this video, so feel free to watch it again, take notes, take screenshots. Again, let me know what phone you're using if you don't know how to do that. No personal information in the comments other than the month of your birthday if you need to share it. I understand this feels like a lot, especially when the stakes are so high. You can get through this like so many have before you. Maybe this isn't the most professional thing to say, but I'm sure you've met people who you've thought, I'm definitely smarter than this person, I can do it. I never said that. But honestly, I understand that it takes a lot more time and energy than it feels like it should. Start with medicare.gov, medicare.gov. You can also call 1-800-MEDICARE or reach out to your local SHIP counselor, SHIP counselor. These resources exist specifically to help you, and I'll work to make future videos more empowering, to give you the tools you need to use and protect the benefits that you have earned with no sales pitch. If you have feedback on how I can make these videos better, please let me know in the comments. This is all general information based on publicly available information, so don't take this as legal, medical, or financial advice. And lastly, if you have any ideas or requests for future videos, please let me know that in the comments as well. With that said, I'm Tony. Thank you so much for watching. I hope you got something out of this video and that you have a beautiful day.